Dr. at the center, if I may come to you.
Yeah.
To borrow the words of the French President Emmanuel Macron, we are in the midst of a war with a pandemic. And in this war, we have deployed our health workers who are the forefront, at the front line. And they yesterday issued a presser saying that we are not given the needed equipment, we are not given the needed protective gears in the country. Therefore, in the midst, as we deploy the boots of the medical doctors on the front line to cushion the country, how do we wrap them up in immunity, at least in reducing cases of them contracting the virus?
Thank you. I think that COVID-19 is here is no longer a question, because it was declared a pandemic, and Kenya being amongst the community of nations, it then puts our populations at risk. So regarding your question on protecting the frontline officers, there's what we refer to as PPEs, personal protective equipment. There has been a lot of concern in terms of our preparations for PPEs. Mm-hmm. There are a lot of dynamics that are going into this. One clear one is that you can see there's no rational use of PPEs. And again, the public has to be blamed partly for this, because you will see a lot of abuse in terms of mask and non-mask usage, mm-hmm. whereas it's critical that some of these are left for healthcare workers, them being at the front line of it, like you rightly said. Mm-hmm. And again, when you look at, like Prof will tell you, whenever there's a shortage, prices of commodities would go up. And the same is occurring on the same PPEs. You're having a basic commodity as a mask, which used to cost, a surgical mask used to cost around 2 shillings. Now one would go up to 200 shillings. Mm-hmm. So that tells you that also people are taking advantage of the situation to drive this shortage. But that PPEs should be provided, especially for the frontline workers, is not a question. That has to be done.
All right. Well noted point. But many Kenyans have equally been concerned about the usage of the masks. Before I come to Dr. Juma here, who is more paramount, or at a point of, at an epicenter point, which is more crucial in using the mask than the other?
Mm-hmm. So first and foremost, again, when you look at public health responses, they're never complex. And one mistake we're making is that we're making it very complex, whereas the basics are usually, basics. So you must then begin to understand what is the role of a mask. A mask essentially is a filter element. Mm-hmm. So that separates the person from whichever offending agent that is across. And there are different types of masks. There's the surgical mask, okay, and there are the more sophisticated masks, which are referred to as N95 or filtration face pieces. So again, when you look at what the World Health Organization has prescribed, they've given guidelines on rational use of such equipment as masks, whereby in a healthcare setting, those that are doing the screening will require surgical masks. Okay. But then when you move further into the system in a hospital setting, you find persons who then are more at risk, what we call aerosol generating procedures. Mm-hmm. So with this, then they require N95 masks. But now we've flipped the pyramid, whereby I think when I was traveling to Nairobi yesterday, I would see a lot of drivers and piki guys putting on N95 masks. So then what happens is that you're now creating another shortage for those who actually require these masks. Okay. And again, when you look at the CDC guidelines, the Center for Disease Control, mm-hmm. Masks are actually not recommended for people who are well. They're more recommended for persons who are unwell, mm-hmm. because like I indicated, this is a filtration surface. Mm-hmm. So then if you're unwell, this protects the other people from whatever you're generating. Mm-hmm. And again, if you look at what the World Health Organization has said, is that if we overuse PPEs, it has a tendency of getting the public to assume that they are protected, and then forgetting the very basic measures, okay, like hand hygiene, respiratory hygiene, which have been shown to be even more important. So that's why I'm saying, as a country, we need to go back to the basics. Stop complicating it, stop inverting the pyramid, and just work with what is prescribed.